Hi, I'm Dr. Bud Holcomb. I'm a practicing psychiatrist in Austin, Texas over the past 20 years. This week, I would like to talk about major depression. What most people mean when they say, I'm depressed, refers to having a decreased mood. However, major depression is a syndrome made up of many symptoms. To be called major depression by DSM V criteria, you need to have at least 5 of these 9 symptoms for at least 2 weeks. Number 1, sad or irritable mood. Number 2, diminished interest or pleasure in things you usually would enjoy. Number 3, feelings of guilt or decreased self-esteem. Also, feelings of hopelessness in that same symptom category. Number 4, decreased energy or fatigue. 5, decreased ability to concentrate or to think clearly. 6, changes in appetite, either increased or decreased. Most commonly, people have decreased appetite and lose weight, but a lot of people will eat emotionally and gain weight. Number 7 is psychomotor retardation or activation. And what that means is that your body is just slow. It's just hard to move, and all movement and speech is slowed down or feels retarded. However, often in children or in people with a lot of anxiety, movement of the body or motor control can be activated or increased. Number 8, changes in sleep. That can be insomnia, which is most common, but many people, when they're depressed, will also spend too much time in bed and sleep too much. Especially associated with major depression is mid-cycle insomnia, where people will wake up in the middle of the night and then have trouble going back to sleep. Number 9 is suicidal ideation or thoughts of death. The reason I read the 9 symptoms in this order for any students out there is because the mnemonic is SIG-E CAPS with 2 S's at the end. Now, many things can cause any of these symptoms individually, and many of these symptoms can occur following a sad loss or death. When someone is sad and has a few of these symptoms, it is called bereavement or grief, and this is natural and very healthy. However, when somebody meets criteria for an episode of major depression, it's a serious illness. The World Health Organization ranks major depression as the second most costly disease worldwide, behind only cardiovascular disease. Major depression is twice as common in women. It's thought that the reason for this is that men are less in touch with their emotions and cope with their depression with anger or alcoholism. As with all common emotional or mental health disorders, there are many screening tests for major depression online, so you can recognize the diagnosis yourself. The symptoms I rely on most that I feel are the most specific to major depression are 1, decreased mood. I ask if 10 is the best and 1 is the most down or depressed, what number has your mood been for the past week or 2? People who have a healthy mood usually are around 7 to 8 over 10. The other group of symptoms that I look for that are more specific to major depression are feelings of guilt or decreased self-esteem. Other ways of saying this are feelings of inadequacy or worthlessness. Also in that group of symptoms is feelings of hopelessness, as if nothing is ever going to change for the better. Guilt and decreased self-esteem and feelings of hopelessness don't occur when somebody is bereaved or sad following a loss. I think it's important to point out that there continues to be a strong stigma against acknowledging having major depression. Unfortunately, many people continue to see it as a sign of weakness. People are so often taught not to be in touch with their emotions or to be strong or suck it up. But being out of touch with your feelings is really just using denial and the opposite of being strong. The strongest trees are the ones that bend, like bamboo. The ones that are too rigid or stiff or strong snap or break. So the brave or wise thing to do is to acknowledge your emotional pain so that you can get it addressed and not have to carry it with us in our current lives. Remember, when people suffer from untreated anxiety and depression, everyone in their lives suffer also. The way to treat major depression is the same as all mental health disorders. First, take away anything that's making it worse, such as alcohol or drugs of abuse. It's very clear that alcoholism makes depression far worse. The depression often gets tremendously better when people get their alcoholism addressed. Often, alcoholism is not the source of depression, but you have to first turn off a broken pipe before you can clean up a mess. And really, anxiety and depression probably cannot be helped unless the alcohol or drug overuse is first addressed. Along the same lines of first taking away anything that makes it worse, it's always a good idea to have a medical checkup to look for any medical problems that may be contributing to an episode of major depression, such as low thyroid. Then the idea is as few pills as possible, because all any medication does is reduce symptoms, whether it's cancer, pain disorders, or heart disease. They're very helpful, but they don't do anything to address it at the source. And that's what good therapy is all about. The medications that are most effective for treating major depression are similar to the meds we discussed for anxiety, the serotonin medications or antidepressants. It doesn't matter so much which antidepressant you choose. Zoloft, Prozac, Lexapro, Effexor. Anxiety and depression are so common and such money makers that there are many effective choices. Even though there's a great need for new types of antidepressants that work by different mechanisms of action, the pharmaceutical industry is driven by profit only, and so there have been no new types of antidepressants for decades. When one antidepressant like Celexa finally becomes generic, they just change it a little bit and call it Lexapro. When Effexor finally became generic, they repackaged it and called it Pristique. The important point is that there's not a shred of evidence that newer medications are any better than older generics, just extremely expensive. Even if your insurance company covers it, we all pay the exorbitant price for our health care. As discussed in previous videos, anxiety is the mother of all symptoms that we suffer, and major depression and anxiety always occur together. Remember, antidepressants or serotonin agents treat both anxiety and depression, but a medication such as low-dose clonazepam, specifically for anxiety, can be very helpful for the treatment of depression. Too often, people look just to the medication to fix the problem. It's no different than if someone is out of shape or has poor diet. They're going to have medical diseases such as cardiovascular disease or diabetes. Nobody is going to fix their heart disease or diabetes by taking pills only. The illness must be addressed at the source. In these cases, that's diet and exercise. In the case of anxiety and depression, that means talk therapy. If depression and anxiety are only partially improved, think more therapy to address it at the source rather than adding more pills. This just makes the pharmaceutical industry rich and doesn't address the anxiety and depression or the person suffering. A professional therapist should have a master's degree or a PhD. If you're already seeing an individual professional therapist weekly, think about also adding a support group. In conjunction with as few pills as possible and as much good therapy as possible to address it at the source, this is what will be most effective towards healing. Thank you very much.